Well, my friends, a few days back, I have given a details writing about Achalasia cardia in Facebook. Now, after few days, today, I have got the same patient. A patient belongs to Achalasia cardia. He is an old patient of mine and already taken 4 or 5 times medicine and gradually improving. Many other symptoms such as catches cold very easily, etc. improved very much. And Achalasia cardia, the disturbance of the food and regurgitations of the liquids through nose is still present, and I am trying my level best to prescribe second medicines one after another dates. Now this is the practical case. The gentleman is about 58 years, a serviceman servicing at Chhattisgarh district, Chhattisgarh state of India. The same symptoms I have told you, and you have already studied in the books that the disease is due to obstruction of the food from the lower esophageal part to stomach. From the lower esophageal part to stomach, the sphincter muscles of the lower part of the esophagus does not work properly. So the food cannot enter into the stomach, very slowly passes, and maximum food deposits here. And sometimes by the upward pressure of the stomach and upward pressure of the esophagus, the watery part or foods goes upwards, result of which regurgitation, eructations, belching, bad taste in the mouth, etc. appears. And mainly the disturbance occurs at night when the patient lying down or during sleep. The pathology already I have mentioned in the writing of Facebook, and while ascending upwards, the food contents and watery materials, some enters into the larynx, goes into the trachea, bronchus and into the lungs, result of which there will be disturbance and dysfunctions of the lungs, which may cause pneumonia and which is known as aspiratory or aspiration pneumonia. But instead of going to the lungs through larynx and trachea and bronchus and causing aspiration pneumonia, some liquid portions may enter into the nasopharynx and may pass into the nose. There are 3 routes. Either these fluid substances or food substances may enter into the mouth cavity and the patient may vomit, or some parts goes into the larynx, trachea and lungs, may cause aspiration pneumonia, and some portion may enter into the nasopharynx and into the nasal cavity and passes through the nose. This patient developed the symptom, the fluid parts of the regurgitation of materials enters into the nasopharynx and comes through the nose at night during sleeping. So this is the Achalasia cardia. He had already consulted with the physicians of Christian Medical College of Vellore, and I have already told in my Facebook writings that there is no treatment in allopathy. The only treatment is, old treatment was Hiller's dilatation, and some modern treatment are also discovered by the modern gastroenterologist surgeons to cut or separate the space. Now the symptom is very marked, nasal regurgitation. Nasal regurgitation of liquid, a watery substance through nose at night. I am talking with the patient. তাহলে আপনার এখন এই রোগটা হয়েছে বছর 10 হয়ে গেল। There is a history of corona vaccine, and the corona vaccine disturbed his health. Numbness sensation of the body, পুরো শরীর অসাড় হয়ে গিয়েছিল ফার্স্ট ডোজ নেওয়ার পরে, অনেক প্রবলেম হয়েছিল। কিন্তু this may not include after bad effects of vaccination because the disease had already started 10 years back. So let us little about the side effects of the vaccination. Now, this is an old disease 12 years back, and he had already consulted the Vellore. Vellore কি বললো আপনাদের?
Vellore বলেছিল যে অপারেশন ছাড়া কোনো ওষুধ নেই। ওষুধ আমি বললাম স্যার কোনো ওষুধ নেই, বলে এই রোগের কোনো ওষুধ নেই, শুধু অপারেশন আছে, বেলুন ফাটানো আছে। বেলুন ফাটালে রিস্ক থাকে, একটা মাসে মনে হয় 6 মাস 3 মাস পর কতবার করতে হবে। আর অপারেশনটা স্যার বললো না করলেই ভালো, একদম যখন মানে কোনো রাস্তা থাকবে না তখন করলে ভালো। এবার যদি তুমি চাও আমি করে দেবো, তা আমার মতে তুমি ওটা না করলেই ভালো।
So the surgeons of Vellore, the Christian Medical College, already they had an aversion to do the operation. That means the renowned gastroenterologists of the world famous Allopathic Medical Treatment Center, Christian Medical College or CMC declared it is better not to operate. Now many surgeons of many nursing homes or in hospitals in Bengal and Bangladesh are ready to operate to earn some money. But the renowned surgeons of CMC already declared, the honest and sincere, that it is better not to operate. The patient herself, his wife herself is herself already told. Now ballooning, they have treatment. Ballooning means dilatation. So in homeopathy, slowly and gradually many patients improved in my hand, and this patient I have already prescribed T. occidentalis many times. A slowly improvement is there, and this time he has claimed that the nasal regurgitation is very much increased. কি হয় রাত্রিবেলা বলুন?
রাত্রিবেলা খাদ্যটা উঠে আসে না, কিন্তু যে জলটা দিয়ে খাদ্য গিলি সেটা বেরিয়ে আসে, জলটা বেশিরভাগই। আর বুকে ভোর রাত্রির দিকে বুকে একটা ব্যথা অনুভব হয়।
Retroesternal pain, already I have told, because the esophagus just in front of the sternum, so the pressure of the esophagus while ascending the food materials and watery materials, the decomposed materials, it gives pressure to the posterior surface of the anterior surface of the sternum, and there may be retroesternal pain. যা বলেছিলাম, whatever I have told, all is found. This is a practical demonstration of the case. So nasal regurgitation, retroesternal pain, all the complaints aggravates at night, at the later part of the night, during sleeping. Whatever I have told in the writing of my Facebook is found in this patient. Now the rubric, the nasal regurgitation, though it is a common symptom of this disease, however, we may find this symptom in our repertory. In the chapter nose, Ken's repertory nose, there is a rubric, liquids come out through the nose, one attempting to swallow. This is not one attempting to the swallow, but we can interpret the symptom, liquids come out through the nose. There are 4 first graded medicines. Aram triphyllum, not important, a very superficial medicine. Other 3 important medicines, all are belongs to L group, Laccananum, Lachesis and Lycopodium. Now among the other symptomatology, my patient is dictatorial attitude. These are for sweets, these are for warm food, and very self decision maker. উনি যেটা নিজে চিন্তা ভাবনা করেন সেটাই করতে চান,
হ্যাঁ উনি
ওটাই করেন। So already we have learned from his own wife. So my next prescription is Lycopodium in 50 millisiemens scale of potencies. Let's see the result, how much improvement we may expect This for this patient who has been suffering from Achalasia cardia. The another name is cardiospasm, and today's choice of medicine after T occidentalis is our Lycopodium clavatum. So let's see the result. This is a serious case, a complicated case, and in allopathic or modern medical science, they have no treatment. The patient is in our hand, and we must try at our level best. Let's see the result. I shall share you, my friends, once again after 3 months.